Headaches and sore throats are being added to an expanded list of possible COVID-19 symptoms. As health reporter Stephanie Stahl explains, this means more people could be infected and eligible for testing. Hi, Stephanie.
That's right, Jessica. The Centers for Disease Control and Prevention has expanded its list of possible symptoms of the coronavirus. Officials say they're learning this virus is unpredictable, with a growing list of symptoms and strange side effects. The CDC is expanding its list of COVID-19 symptoms.
Literally every day we're learning more. We're learning about what it can do to the body.
New symptoms include chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. The initial symptoms were fever, cough, shortness of breath, and difficulty breathing.
I think that we'll have somewhat expanded criteria for what constitutes symptoms. I don't think we want to test everybody who has a headache.
The expanded list of symptoms means more people could be eligible for testing, but the Philadelphia Health Commissioner says limited supplies remain an issue.
I don't think it's going to make a huge difference. What's going to make the biggest difference as far as the number of people we test is just how many of the swabs we have and how many tests our laboratories can run.
For people with positive cases, some are developing widespread blood clots.
So this is new. This is something that obviously has us on alarm.
Most patients with serious cases of COVID-19 have lung damage, but now doctors are seeing blood clots in places like the brain and kidneys.
That is absolutely a new frontier. I don't even know what will be the other atypical and unusual presentation of COVID-19.
It's unknown whether the coronavirus itself causes blood clots or it's an inflammatory response.
We're seeing it in 30, 40, and 50-year-olds, and many times in people that are not that symptomatic with the virus.
And blood thinners, the standard treatment for blood clots, don't appear to work as well with COVID-19 patients. Doctors don't know why, and they say a variety of experimental treatments for this coronavirus have been disappointing. Jessica?
All right, Stephanie, thank you.